Hello everyone, today we are going to read about one of the important disorder of amino acid metabolism, that is phenylketonuria. So as I have already taught you, the conversion of phenylalanine to tyrosine occurs through the enzyme phenylalanine hydroxylase. So phenylalanine hydroxylase upon the action of on the phenylalanine gets converted into tyrosine. So the phenylketonuria occurs due to the decrease in phenylalanine hydroxylase or decrease BH4 cofactor. So this BH4 cofactor is tetrahydrobiopterin. So if there is decrease in BH4 cofactor, then this phenylketonuria is also called as malignant phenylketonuria. So as you know that the tyrosine is non-essential amino acid, because the tyrosine can be converted from the phenylalanine and it is produced in our body. So with the absence or decreased amount of phenylalanine hydroxylase in our body, the tyrosine becomes the essential amino acid in this disorder. So what happens, due to the low conversion of the phenylalanine to tyrosine, there will be the increased amount of phenylalanine in the body. So and this phenylalanine ultimately passes in the urine, resulting in increase in concentration of the phenylketones in the urine. And what are the phenylketones? The phenylketones are phenylacetate, phenylacet, and phenylpyruvate. So this phenylketonuria is autosomal recessive disorder. The incidence of the phenylketonuria is 1:10,000. The screening of phenylketonuria can be done in 2 to 3 days after birth, because in the initial days the level of phenylketonuria could be normal at birth because of the maternal enzyme during the fetal life. So the phenylalanine hydroxylase level during 1 or 2 days of the birth can be normal because of the maternal enzyme, because of the presence of maternal enzyme. So it is good to do screening after 2 to 3 days of the birth. So what are the various findings in the phenylketonuria? The various findings in the phenylketonuria: the person with phenylketonuria present with intellectual disability, growth retardation, seizures, fair complexion, eczema, the musty body odor. The musty body odor is due to the disorder of aromatic amino acid metabolism. So what is the treatment of the phenylketonuria? So mainly the treatment includes decrease of phenylalanine and increase of tyrosine in the diet. So what are the various phenylalanine rich food? The various phenylalanine rich foods are milk, eggs, cheese, nuts, soybean, chicken, beef, pork, bean, and fish. What are the tyrosine rich diet? The tyrosine rich foods are chicken, turkey, fish, peanut, almonds, avocados, bananas, milk, cheese, yogurt, cabbage, lima beans, pumpkin seeds, and sesame seeds. So these are the phenylalanine rich foods and these are the tyrosine rich food. So we have to decrease the consumption of the phenylalanine rich food and increase the consumption of the tyrosine rich food in phenylketonuria. Now let us discuss about the maternal phenylketonuria. The maternal phenylketonuria occur due to lack of proper dietary therapy. The findings in an infant is microcephaly, intellectual disability, growth retardation, and congenital heart defect. So you have to take in mind that the person with phenylketonuria must avoid artificial sweetener, asparagine. So this asparagine which contains phenylalanine. So if you take the artificial sweetener, then there will be the supplementation of phenylalanine in our body. So if there is decreased amount of phenylalanine hydroxylase, there is already the increased amount of phenylalanine. So if there is the extra supplementation of the phenylalanine, then it can aggravate the disorder phenylketonuria. Also, we can give tetrahydrobiopterin supplementation. So these are all the treatment. So in this today's topic of phenylketonuria, we discuss brief about the introduction, the pathophysiology, the incidents and the various findings of the person with the phenylketonuria, and we also discuss about the treatment. We discuss about maternal phenylketonuria. We discuss about the phenylalanine and phenylalanine rich diets and tyrosine rich diets. So I hope you understood this lecture. So this sums up our phenylketonuria topic. Thank you.